is Tori. I'm going to be your nurse today. What brings you in?
I just have some, I feel like I have a little sinus drainage, some pressure here and here.
Okay.
Cough at night.
Okay. How long has this been going on?
About 3 or 4 days.
Okay. Have you been taking any medications at home to help with the symptoms? Okay. What home medications do you take?
Metformin.
Metformin. Okay. So you're diabetic?
No PCOS.
Oh, okay. All right. What about your health history? Do you have any kind of hypertension? Any significant problems?
PCOS.
Okay. What about your mother and your father? Do they have any significant history?
My mom has no history at all. She's healthy,
Okay.
and I don't know my dad's history.
Okay. And do you have any allergies to anything?
No allergies.
Okay. Where do you work at?
Work at UK.
Okay. Are you
A
a
nurse.
nurse? Okay. And how long have you worked there?
Just 3 months.
Okay. All right. Well, I'm going to start off by getting your vital signs and all that, okay? Take your temperature. All right, 98.7, which is good. Have you ran a temperature at home or have you checked? Okay. Check your blood pressure and your pulse. Alright. Your pulse ox is at 98 on room air, which is good. And your blood pressure is 124/60. I'm going to go ahead and start my physical assessment. I'm going to do a head to toe assessment and work from your head all the way down, okay? And can you tell me your name and your birthday?
Alyssa Nichols, 3890.
Okay. Alright, well, let's start it. First, I'm going to have you stand up for me. And I'm going to test your gait. I'm going to have you walk to the file cabinet and back. Alright, and now I'm going to have you stand in front of me and hold your arms out and shut your eyes. Okay, that was the wrong first test to test your balance. And now I'm going to have you squat. Alright, and then I'm going to have you move up just a little bit and bend over. And I'm going to assess your spine for curvature. Okay, and then I'm going to assess your hips. Make sure they're equal. Alright, and now I'm just going to have you hop on one foot. Okay. Alright, you can go ahead and sit down on the bed. Alright, and I'm just going to start by looking at your skin, assess and make sure it's warm, dry, and pink. No scars, no bruises, anything like that. Which you look good. Alright, I'm going to start with your head and just check for any abrasions, any lumps or bumps. Make sure it's symmetrical. And it is. Your hairline is distributioned well, and you have healthy hair. Alright, and I'm going to go ahead and assess your face, make sure that your eyes and your nose and mouth are symmetrical. And they are. I'm going to go ahead and look at your eyebrows and your eyelashes, which they're midline. And I'm going to go ahead and palpate your temporal arteries. And good. Alright, and then I'm going to go ahead and do your lymph nodes and start the pre-auricular, post-auricular, cervical, tonsillar, submandibular, and now I'm going to check your bladder. Okay. Alright, and now I'm going to go ahead and assess your jaw for TMJ. Can you open and shut your mouth? Okay. And now clench your teeth. Okay. Alright. Now I'm going to go ahead and check your sensory. I'm going to use a Q-tip and have you shut your eyes. And then tell me where you feel this at.
Forehead, chin, cheek, red cheek, nose.
Okay, good. Alright, now I'm going to have you look at me and smile and frown. And act like you're going to blow me a kiss. And puff your cheeks out. Okay, that was checking cranial nerve 7. Now I'm going to go ahead and move on to your eyes. I already checked to make sure your eyebrows and eyelashes are symmetrical. I'm going to go ahead and look at your sclera, which is white. I'm going to look at your conjunctiva in each eye, which should be pink. And it is. Alright, and now I'm going to go ahead and look inside of your eye and check for make sure your pupils are round and reactive to light, okay? Okay. So I'm going to have you look straight at me, and I'm going to check your pupils, make sure they constrict equally. Okay. Now on this side. Alright. And now I'm just going to look directly into your eye. Okay. Alright. And now I'm going to go ahead and look into your eye, check for the red reflex. Yeah, the red reflex, and check your eye out, okay? Alright, looks good. Alright, and now I'm going to go ahead and test your peripheral vision. And I'm going to have you tell me when you can see my fingers, okay?
See your fingers. See your fingers.
And,
See your fingers.
okay. And now I'm going to have you look at my finger. Keep your head straight and follow. Alright, and now follow in. Great. Alright, now I'm going to go ahead and move to your ears. I'm going to check for symmetry, make sure there's no drainage, which there does not seem to be. Do you have any tenderness when I feel your ears? Okay. Alright. I'm going to go ahead and look inside of your ears. I'm going to pull your ear up. The inside of your ear is probably white, which is what it should be. No drainage. Same on that side. Alright, I'm going to go ahead and go behind you and do, it's called a whisper test. I'm going to have you occlude one of your ears. And I'm going to whisper something and you tell me what it is. I said, okay.
Basketball.
Okay, on this side.
Baseball.
Okay. Alright, now I'm going to use the tuning fork, and you're going to tell me if you hear it in both ears or just one ear, okay?
Both ears.
Okay. And now you're going to tell me when this noise stops, okay?
Stops.
And now,
Stops.
same on this side.
Stops. Stops.
Okay, good. Alright, now I'm going to go ahead and move to your nose. Obviously I'm going to check and make sure it's midline, no deviations, no drainage, which I do not see any. I'm going to go ahead and have you occlude one of your nares and, yep, and on the other side. Okay. And now I'm going to look in your nose, okay? Just check for any drainage, any lesions, anything of that sort. And you do not have any. I'm going to go ahead and assess your sinuses too, okay? Do you have any tenderness when I push here? Okay. And down here?
Yeah.
Any tenderness? Okay. Alright, and now I'm going to go ahead and move to your throat and your mouth. I'm going to just have you open your mouth and look inside of the light. Alright. It's all pink, no lesions, no bumps. Alright, and I'm going to have you open your mouth and say ah. Say ah. And I'm going to have you stick your tongue out at me straight. Okay? And alright, and I'm also going to put on a glove and just feel around and make sure that there's not anything that I missed, okay? Okay, good. Stick your tongue out for me. Alright, there's no bumps or lumps. The tongue is midline and everything looks good. Alright, so I'm going to go ahead and move to your neck. Of course, I'd be checking, make sure your temperature's good, no bumps, scratches, scars, tattoos, anything of that sort. So I'm going to go ahead and feel your carotid artery on both sides. Good. I'm going to check to make sure your trachea is midline, which it is. And I'm going to have you turn your head that way so I can check for jugular vein distension, which there's not, and this way. Alright. I'm going to go ahead and assess your thyroid as well. Alright, I'm going to have you swallow. Okay, good. Alright, and now I'm just going to check your range of motion in your neck, okay? Can you tuck your chin to your chest and extend your neck and look to the right and to the left, and now just roll your head. Okay, good. Did you have any pain? Okay. And now I'm going to go ahead and listen to your carotid artery to check for a break. And look at that. Alright, and I'm going to go ahead and also go back and feel your temporal pulses. Very good. And have you ever had a broken nose or anything? Okay, so you shouldn't have any septal deviation. And I didn't see any when I did your assessment. Also, I'm going to go ahead and have you push up on my hands. That's checking cranial nerve 7, or 11, I'm sorry. Alright, I'm going to go ahead and go to your back and listen. Alright, of course I would assess for color, temperature, any moles, tattoos, bruises, or rash. Alright, and now I'm going to go ahead and listen to your lungs, okay? I'm going to have you take some deep breaths. Okay. And now, every time that I place the stethoscope on your back, I'm going to have you say E, okay? E. 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 Okay. Now I'm going to have you say 99 when I put just got stuff on your back, okay?
99, 99, 99, 99, 99, 99.
Okay, and this one is called the Whisper Petriloquy. I'm going to have you whisper 1, 2, 3 when I place the slippers. Okay. I'm going to go ahead and check for symmetry. Can you take a big deep breath? Okay. Have you had any shortness of air or difficulty breathing?
No.
Okay. And while I'm back here, I'm going to go ahead and check for CVA. You tell me if there's any tenderness, okay?
No. No.
Okay. All right. I'm going to come back around here and I'm going to listen to your lungs. Okay. Okay, good. Alright, and I'm going to check, make sure your chest is equally rise and falling. I'm going to check your skin turgor. And it's good and elastic. And then I'm going to go ahead and listen to your heart, okay? Alright, start up here. Aortic, pulmonic, Erb's point, mitral, tricuspid, then mitral. I'm going to listen to your apical pulse for a full minute. Okay. And I'm going to go ahead and percuss the front of your chest on your lung sound and then on the back. Okay, I'm going to do that. Okay, good. Now I'm going to go ahead and have you lay down and roll onto your left side. And I'm going to listen at your point of maximum impulse. Okay, good. You can go ahead and lay back flat. I'm going to go ahead and inspect for any heaves or lifts, which I do not see. And I'm going to just feel for any thrills. Okay, good. Now I'm going to go ahead and listen to the lung fields again and listen to your apex. Listen to your heart. Okay, and I'm going to listen to your apical heart rate again. Okay. And now I'm going to go ahead and I'll go to your abdomen. First I'm going to inspect for any bruising, scars, check to see if it's distended or if it's brown, if you have any tenderness. I'm going to palpate. You have any tenderness in any of your regions?
Mm-mm.
Okay. Go ahead and listen, starting in the right lower quadrant. Okay, they sound good. And now I'm going to go ahead and percuss in each region. Okay, sounds good. Now I'm going to go ahead and palpate your liver and your spleen, okay? I'm going to have you take a deep breath in. Okay. Alright. And now I'm going to go ahead and listen for any Brits. Start in your aorta. In your renal. Iliac. And femoral. Okay. Alright. Now I'm going to go ahead and start with your arms. I'm going to just check for color, temperature. And I'm going to go ahead and feel your pulses on both sides. Your brachial and your radial. Okay. They both feel equal. I'm going to go ahead and check your capillary refill. Less than 2 seconds. Which is good. Alright, and now I'm going to go ahead and start with the range of motion. I'm going to have you take your elbows, and you having any pain with your joints? Okay, with your wrist, I'm going to have you circle them around. Any pain there? Alright, and then with your hands, just, okay. And I'm going to have you sit up for me. And I'm going to assess your shoulder. I'm going to have you stick your arm out and pull it around. Okay. Okay, how does that? Alright, and then I'm going to go ahead and have you, I'm going to place an object in your hand, and you're going to tell me what it is, okay? I'll show my foot. Take a foot. Okay, good. And now I'm going to have you you can open your eyes. And I have you take your fingers and touch your thumbs. Okay. And then I'm going to have you touch your legs. There you go. And I'm going to have you shut your eyes and tell me where you feel. And where you feel this at, okay?
Left arm. Right arm. Right leg. Left leg.
Okay. And keep your eyes closed and hold your hand out. And tell me what number you need your arm.
Do it again. 8.
Okay, good. Alright. And now I'm going to check your reflexes. Alright, I'm going to check it right here. And check your wrist. Alright, and on this side. And your wrist. Okay. Now I'm going to check your patellar. check your pulses behind your knee. The anterior tibialis. And then the dorsalis pedis. Alright, and I'm going to have you lay back down. Sorry. I'm going to have you bring one leg up to your chest. Alright, and the other. Any pain with that? Okay. And now I'm going to have you bring both legs up. Alright, and now push out. Alright, now push in. Good. Alright. And I'm going to have you roll your ankle around. And the other way. Any pain with that? Okay. I'm going to check range of motion in your toes. And check your capillary refill. Which is good. Okay. Any pain with any of that? I'm going to go ahead and check for any redness, pain, swelling of the peripheral extremities. Alright, I'm going to have you push and pull. Alright. Alright, and that concludes my exam. Do you have any questions? Okay, thank you.